You tell us a little more about that.
Yeah, so Asian Americans for Community Involvement, they're just shorthanded to AKI, just the acronym AACI.
AACI.
But Aki and the task force, we recently started to reach out and collaborate and talk more about us helping to spearhead their efforts to support community health worker trainings in the Pacific Islander community specifically. So basically, from meeting with their leader, apparently they received money from the to essentially start training of Pacific Islander and Asian community members. And so this funding stream has been it's I think it's like $1.6 million in total they have received. And so they received that money over 4 years. And so they are only now halfway through that funding period. And now they started to reach out to the task force because they know that we work with Pacific Islander communities specifically to start to see how we could collaborate to train our Pacific Islander community in Santa Clara County on these trainings. So that's mainly Una. Like we're just now starting the early conversations. And this is a little different from the Foothill Community College training program that I talked about last time we were here.
Oh, it's not the same?
No, it's not the same. So rather than having 6 to 9 month period
Right.
of taking courses and learning about health and community health work, for the certificate program, these Aki courses are much simpler. They're just a one-time sort of 2 to 4 hour long courses that you will just take. And I think it's mostly for your own edification, like just learning,
Great.
what the whole work of being a community health worker looks like today. It's kind of a very new field. It's it's essentially somebody who's in the community who wants to help other community members in their same sort of ethnic group or racial background, but
Right.
really trying to be that advocate for them to access healthcare, access programs that the counties are offering, if there's any programs for like social needs, diapers or food, that just linking community members to supports that are available. That's like what community health workers are. And so I guess, it's now becoming a thing that people are or organizations are paying for, or systems like Medicaid, they are now reimbursing for community health worker work. All of which to say that it's a very new field in the United States. And basically, our Pacific Islander community can benefit from training in this field, this new field of kind of connecting community members to resources. That's a job. That's a whole occupational path. So I think the task force, we're trying to kind of keep mind of that kind of workforce development pipeline. We always want to try to improve our Pacific Islander community opportunities to get trained, in the health profession. So I think that's kind of what our focus is on
That's
right now.
great. That's
Yeah.
great. So, okay, so you said it's not the same thing that as the one we discussed a few weeks back. So here we are. You said it's about 2 hours to 4 hours,
Yeah.
the
So
course
so
itself.
yeah. So they're courses that I think the organization Aki will launch a module, and then so it'll be that course for 2 hours to 4 hours, and they range in topics. Like some is just kind of an introduction to the fundamentals of being a community health worker. Because what does that word mean? Community
Right,
health worker.
right,
What does it mean to be a CHW? What does it mean in the American context? What does it mean in different racial and ethnic groups?
right.
Because like for example, the Spanish speaking community, the Latinx community, Latino, whatever you want to call them, they have a term for community health worker. They call it promotora, like a promoter almostly,
Got
like
it.
a promoter of health, and they call it promotora.
Uh huh.
But every community kind of has a word for it, but I think like the broad language is community health worker. And so, yeah, what is a community health worker? What do they do? Where do they work if they get certified? You
Right.
know, and where do they work if they get trained?
What are the
And
opportunities
what are the
available?
exactly, and like what is the salary range too for being, if you're certified, you know, how much can you expect to get paid if this is like a health profession that you kind of want to be
Right.
more driven in, if you don't want to work like in a clinical setting, like as a nurse, as a physician, as a nursing aide, this is another option or another avenue for you if you want to kind of get health trained, but really support the community, but just in a different way.
That's great. So, where do these trainings and how soon do you expect the first batch or the first lot to begin?
Yeah, so the task force is just now starting to kind of coordinate with Aki and meet with them, because, as I said before, kind of at the top of the program, the task force, we're entering on the third year of their 4-year funding. So we're kind of jumping on a little late
Right.
onto the boat. So we're still going to get oriented, and I'm hoping that, you know, in the coming weeks, we're going to meet with Gerard Manuel, who works there, and leads the program and this funding stream to train community health workers. We're going to meet in the coming weeks, and I'm hoping that we could start to launch them. And then, you know, next time I'm on the show, I hope that I could like explain directly like how to sign up for it,
Yes, please.
the next modules, you
Right.
know, and because I feel like, you know, it's one thing to advertise about the Foothill Community College Certificate Program. But you know, in speaking with Tao, our task force leader, you know, we really think that taking the Aki trainings first might be a good on-ramp for the community,
Got it.
because not everybody has the time or space or energy to take a whole certificate program over 6 months or 9 months.
Right.
It's a lot of time investment. And so in wanting to kind of meet the community where they're at, that's just one avenue. If you want to be certified and trained with that professional skill, you could take that avenue, and it's a fully funded program at that community college. But then another avenue is if you kind of are interested in the topic or subject matter, but, you know, I just want to learn more, and you could take this free program offered through Aki, and the task force can try to coordinate in getting that module to you, and then helping just upscale what the Pacific Islander community knows already, I think. But really just trying to, you know, take a course and really just to check if you know it as well as you know it, and it maybe learn something new if you didn't already know that topic. So
Right. That's great. Great stuff, Koa. So hopefully the next time you come on the show, you would have definite dates on when it starts and how it starts. So
yeah.
can they do it online? Can they do it virtually, or is it in person?
You know, that's such a good ask, Una. I had a hunch that it's actually offered online, but I'm not sure. I do think that from talking with Aki, you know, the organization, it sounds like it'll be offered online because it's more accessible that way.
Exactly.
But you know, I'll be sure to ask when we next meet, because I'm trying to schedule that right now, honestly.
Okay.
To meet hopefully this week or next week with the organization to go over these details.
Details.
But you know, all I know is that there's just different topics or different modules. Like the fundamentals of like what CHWs are is one example, but they also have other trainings about like chronic disease management. So like, you know, trying to you know, maintain your blood sugar, your blood pressure, just managing the diseases like diabetes, hypertension, and that kind of thing. There's also trainings about, you know, intimate partnered violence. So like domestic abuse.
Domestic violence.
Yeah, which is, you know, a very difficult topic, I think.
Right.
Especially if like for Pacific Islanders to engage in, it's I feel like it, you know, we definitely should engage in that topic. It's even though it's kind of a controversial topic, I think it doesn't mean we shouldn't have that conversation. So, you know, there are just options for whoever is interested.
Right. Great. Thank you. Thank you, Koa. So I'm hoping that when you do get all these details that, you know, it's something that people can have access to online, just because our people, we know everyone's busy working. But let's say I'm so
Yeah.
busy, but I would love to be able to attend. I'd love to be able to kind of add this to my resume, so to speak. And
Yeah.
if I could do it virtually, I would. And that'd be great. If that's something we can do, then we would love to be able to have you back and talk about it and like really kind of rally our people. So, you know, get them to get in on this course. And you said it's fully funded, which means it'll be
Yeah.
free. It'll be free for all kind of thing.
Yeah, I believe it'll be free. I know that much for sure. I just don't know like when next they're offering it, and then like you were saying before, whether or not it's only in person or if they have an online option. But my hunch is that they do have an online. But I'll verify that because I'm hoping to meet this week, as I said, and we're excited about this new relationship with Aki. The task force kind of never really worked this closely to kind of jump on this funding stream that they're receiving because I think they're called the Asian American community involvement, not Asian American and Pacific Islander. So it's nice, I think, that they're kind of orienting us in that funding stream because I think the intention of the funding stream I was reading is to really focus on both Asian and Pacific Islanders. So my only feeling is that I wish we had jumped on sooner,
Earlier.
like two years ago. Yeah, because then, maybe we would have had more time to really get a lot of ideas up and running. Because I heard from the Aki leadership that we might even be able to create a health intervention kind of with Pacific Islander community in mind. And we still may be able to in the 2 years. So that's just something to think about going forward, is that we hope that we could create something still, even though we only have 2 years left.
Hey, better late than never, right?
Exactly. And I have faith that, with all the thought partners in the Pacific Islander community, we could figure it out quickly and just get up and running.
Right.
So yeah, I'm hoping to meet ASAP and then have an update for you in a Monday or Friday sometime soon. As soon as I know something, I'm actually going to also on Radio Tonga tomorrow to talk about them, just to kind of drum up interest.
Great.
And I'm hoping any listener, if you have any questions about, what are these community health worker trainings, like please write them in the chat, and then I'll try to look at the chat later on and collect them, and then be sure to ask Aki all those questions.
Okay. I think the biggest question that our listeners would have, if any, is when, like you kind of touched a little bit on what the cause is, what community health worker is, and what this could help, how it could help a person, like kind of a pathway to, the medical field. And like, as you know, most of us do caregiving, and then most of us really go on to get their CNA and the LVN, and then eventually into the nursing field. But this would be great if, because most of us do caregiving, and most of us are so involved in our community, or would love to be able to be more involved in the community, and in whatever way that we can help, especially health-wise, this would really help. And so questions would be like, when can we start? Like, what exactly is there that we could learn? And like the certification, what is it? How can it help us get a job maybe? And if we can do it online, that would be great, because most people do caregiving and they do have downtime, but they're not able to leave work or leave their patient physically, so they can be there downtime and do stuff online. And the good thing is we could do most of the stuff we do online on our phone, right? So those would be the questions that I could think of right now. Maybe once you have more information, we will be able to kind of have more questions.
Yeah, and then honestly, it'd be a learning experience for both of us because, the task force has never worked with this organization before. But, it's important because we'll be one of the only organizations working on behalf of Aki who focuses with Pacific Islanders. So I'm hopeful that, we'll be the ones kind of trying to make sure that we get as many Pacific Islanders through the different trainings, and then to promote them and publicize them like on your show and Radio Tonga, just to encourage the Pacific Islander community to take them up. But yeah, I'm excited. I hope a lot of Fijian community members are interested in the different topics. There's some even around like patient navigation, even I think I saw. But and they're also very interested in creating, some sort of training that's relevant to us. So if the Fijian community, has any sort of desire to build something, I think there's, so much option here to kind of create. So yeah, I'll do a lot of digging on my end to try to figure out, what that looks like and how do we participate. But yeah, we're just only starting to enter the conversation about what these look like, and then how these are different from the Foothill Community Health Worker Training Program or the certificate program. In my eyes, they're kind of all in the same. They're just training the community in different ways you can learn or approach community health worker work, but learning it, just in different formats.
Right. Do you know if there needs to be like some kind of qualifications for someone to be able to attend this and be a public health worker?
I don't think that there's any qualifications for this at all. I mean, if like the task force feels that that the group that we're sharing the information with are kind of navigating to the courses or modules, I think that there's kind of this honor system that it makes sense for that community. So there's no qualifications outside that, that you're a Pacific Islander and you have the time to take this course. It seems like they're all kind of multi-hour long, but it's not like more than one time. So you'll just take the module and be done.
I see.
Versus like taking a course over many weeks, over many months.
That's great.
A different kind of training, but we're very excited. There's just many ways you can engage with this new field of being a community health worker, and my sense on it is that it's good that the country is starting to pay for these things,
right?
Or the United States is starting to value community members linking other community members to resources as a work stream.
That's great. Thank you, Kekoa. So hopefully the next time we talk about this, we would have come up with a Fijian name, just like how you said the Spanish have their
promotora.
own promotora.
Yeah, I hope somebody could let me know if they have any Fijian word that they think would
definitely come up with
that.
Yeah, we could definitely come up with something. And I think it'll be great. It'll be fun to have a name specifically for this public health worker. And, like I said, most of us love to help in our community. So once we get all that information, Kekoa, I'm sure we could rally a lot of people and to be able to do things online and become a public health worker would be a plus in our community, just because, like I said, a lot of us do caregiving. And as we know, our Pacific Islanders, we are always, and all in need of public health work, or like just being able to go in and get checked by doctors and just be on top of our health. Like health is wealth. We always talk about that, so it is important that we prioritize this. So I am looking forward to your updates and be able to come back on the show with a lot more in-depth information pertaining to this. Any words for our listeners before we sign off today, Kekoa?
No, other than just please, any questions about this, all the different community health worker trainings that I've mentioned on the show. If anyone has any questions, put them in the chat, and then I'll try to address them on my own after the show.
Thank you. Kekoa Lopez and Regional Pacific Islander Task Force and on songo karto mai beito ko ni sartiko vakalevu and kenangarabi tiko vakaidur tiko ni na bengarabi tostiko na bengarabi na bisinga and nonda batabatongo na Radio Bulando Vata.
Ongo na Programo World man Regional Pacific Islander Task Force. En a radio mulundong te San Francisco, na Kilti Kenta Patamay.